Thank you all for joining me today. It's a pleasure to speak at the 41st Annual Congress of the Korean Society of Critical Care Medicine, together in partnership with the Japanese Society of Intensive Care Medicine. I'm grateful to the organizing committee for the invitation to speak about the role of vitamin C in treating sepsis. I'm Greg Martin, a professor of pulmonary and critical care medicine at Emory University and president for the Society of Critical Care Medicine. I have spent my career conducting research for sepsis and ARDS, and now COVID-19, and a notable conflict for this lecture is my role on the VICTUS trial, studying vitamin C and funded by the Marcus Foundation. Over the next 30 minutes, we're going to talk about the different aspects of vitamin C and where it may fit in treating sepsis, starting with the rationale and biological roles for vitamin C with thiamine and hydrocortisone for treating sepsis. And secondly, exploring the background knowledge of vitamin C deficiency in critical illness. And finally, discussing the current clinical evidence for using these drugs to treat sepsis. A case series from a single hospital received substantial interest from both the media and from ICU clinicians because it reported the experience of physicians who felt that several patients who were gravely ill unexpectedly survived after receiving vitamin C, thiamine, and corticosteroids together. This paper reported that consecutive patients who received these three drugs had much lower mortality than matched patients seen previously at the center. The absolute risk reduction in mortality was 32%, falling from 40% to 8% when compared with matched historical controlled patients. Let's start with the rationale for what we call triple therapy in sepsis, meaning the biological rationale for the use of vitamin C, thiamine, and corticosteroids together in treating patients with sepsis. One of the things that we know is that plasma vitamin C levels are very low in critically ill patients with sepsis. And in fact, subnormal levels are universally present in these patients. Now, we also have seen that ascorbate levels, meaning levels of vitamin C, correlate inversely with the incidence of multiple organ dysfunction and with mortality, meaning that lower levels of ascorbate levels go along with higher numbers of failed organs and higher mortality. Each of the three drugs has a potential role in treating patients with sepsis. Thiamine is an essential vitamin for aerobic metabolism, and thiamine deficiency may cause lactic acidosis. Ascorbic acid is similarly important for aerobic metabolism and is also a potent antioxidant and a cofactor in the production of endogenous vasoconstrictors, while corticosteroids have broad anti-inflammatory effects. One of the first clinical studies to inform the use of vitamin C in sepsis patients was a phase 1 study conducted in Virginia of 24 critically ill sepsis patients with organ dysfunction who were treated either with a lower dose or a higher dose of vitamin C or instead with a placebo. And what Barry Fowler and his team saw was that vitamin C treated patients had higher levels of plasma ascorbate and a reduction in organ dysfunction that was dose dependent. That same group followed up the earlier sepsis study with a similar study now in patients with sepsis-induced ARDS, known as the CITRUS ALI study. And in this study, 167 patients with acute lung injury or ARDS were randomized to the higher dose of vitamin C, 200 milligrams per kilogram per day, used for 4 days, or to be treated with a matching placebo. And what they saw was a reduction in 28-day mortality, a reduction from 46% to 30% that was statistically significant. There was no overall difference in SOFA score, but when accounting for the differences in mortality, there appeared to be a lower SOFA at 96 hours in the patients who were receiving the vitamin C. There also was slight or at least modest suggestion that there may have been more rapid ARDS recovery with more ventilator-free days and also ICU recovery with more ICU-free days. However, of all the other biological and physiological parameters, nothing else was significant between the two groups. And one of the things that we learned from that study was that the administration of high doses of vitamin C can lead to inaccurate and misleading measurements of point-of-care glucose, to the point that the point-of-care measurements will be higher than the actual glucose when it's measured in a clinical laboratory. And this can be a problem because it can cause you to miss hypoglycemia, because the point-of-care measurement may appear normal when the actual result is low, or it can actually cause hypoglycemia because we think the glucose is high and we give insulin even though the glucose level was not as high as we thought it was. Knowing that there's several potential benefits, as well as potential adverse effects from using high-dose vitamin C in critically ill sepsis patients, lends itself to a systematic review to better understand the clinical evidence. However, many of the clinical studies have a lot of heterogeneity in them, which makes it difficult to synthesize them together into a point estimate in a systematic review. For instance, in this review, the studies did not necessarily require randomization or even having a control group, but this did suggest that maybe there was benefit to vitamin C associated with a shorter time on mechanical ventilation, and that benefit appeared to be most present in the more severely ill patients with the longest mechanical ventilation. However, the results of this systematic review are limited by the heterogeneity of the trials that had been conducted with vitamin C. Looking at the clinical evidence for the use of vitamin C and thiamine in treating patients with sepsis, one of the first studies was this one out of South Korea that looked retrospectively at the use of vitamin C and thiamine together in 229 septic shock patients. And what they saw was overall no difference in mortality, except perhaps in the subgroups of the patients who had a low albumin or who were more severely ill with a higher SOFA score. This study from South Korea compared the use of vitamin C, thiamine, and hydrocortisone together in treating severe pneumonia. In this retrospective series of 53 patients, those who were treated with vitamin C at a dose of 1.5 grams every 6 hours, along with thiamine, 200 milligrams every 12 hours, and hydrocortisone, 50 milligrams every 6 hours, was compared to 46 matched severe pneumonia patients